right, thanks, Tuan. Well, welcome everybody. Yes, painless experience is one of our selling points as a profession. So I am going to just jump in and cover a little bit about the profession. This is definitely not meant to make you an expert. Obviously, we have just a small window of time, but really just to give you a quick overview of seeing yourself possibly as a doctor of optometry. And yes, optometrists and admissions officers love using C, I, anything we possibly can related to vision. So jumping right in here, what do most people think an optometrist does? Right? In your mind, you're probably going glasses or contacts, right? Tuan was a case in point for that one. Yes, absolutely. Optometrists do that. But I want to stretch your thinking a little bit here because it is a 4-year degree program. And I can assure you it does not take 4 years to learn how to do those two things. Okay, so here's the areas that optometrists can practice. And these are just the most common. There's obviously one-offs here and there too, but individual private practice, partnership group practice, that's probably what you've been to. That's what Tuan went to, right, to get his glasses. 1 or 2 people, maybe 3, 4, 5 in a practice like a optical service, possibly a Target, something like that maybe you've seen. But that's pretty common what a lot of people think. Academia research, that's anything, right? Any field you go into, you could probably go into one of those 2 areas as well. So that's not necessarily specific to optometry. But now here's where it gets kind of like, wait a minute, how does that part work? Military, VA, which is Veterans Affairs, hospitals, or public health. So this is an area where we literally have optometrists who go through a 4-year degree program on staff at major hospitals. They might be working with traumatic brain injury patients. They might be working with post-op, patients, pre or post-op care for patients, working in kind of overall managing a patient's health as well with other medical practitioners, cardiologists, neurologists. So this is now we're expanding the glasses and contacts thing, right? How does that possibly work? And again, we don't have a ton of time to dig in today, but we will tap on that a little bit in a second here. Interdisciplinary care, like I just said, co-managing, working with people from other different areas and different professions. Professional corporate affairs, that's kind of standard for a lot of industries as well. That's, working for the people who make the frames, the people who make the eye drops, right? All those kind of the back end of what we do as an optometrist on the front end. Optometry and ophthalmology professional setting where you can be in a practice together. So optometrists do not do surgical procedures such as cataract surgeries, for example, or if there's a retinal tear, and I might be talking over some of your heads right now, but I know some of you are on the call already focused on the profession. But that's what an ophthalmologist does. They go to medical school and then additional training and fellowships and all these different things after. So they're looking at probably 8 to 10 years to be able to do what they do. You could work in the same practice and even co-own a practice with them and do the patient care on the front and back end of the surgical procedures if you like a little bit more of that kind of intense side of things. And then community service and mission trips, there's a ton that you could do within the profession of optometry and make a really great impact. So those are just a few different ways that you can practice. Now, here's what I want to do next. And I'm not really big on dictionary type stuff, but I think in this situation, it's helpful. So here's what the American Optometric Association says an optometrist is/does. Okay, so we primary eye care providers, we knew that, right? That's the whole glass and contacts thing. You probably could have guessed that part. The next part here, ODs are essential healthcare providers. Thanks to the pandemic, we all know what essential workers are, right? Essential healthcare providers, meaning this is not a negotiable thing, right? You want to go into a secure career, you don't go into one that's like, take it or leave it, may not necessarily need it in 10 years, right? This is essential and very long-term. We're recognized as physicians. So yes, you're an actual doctor. Examine, diagnose, and treat diseases and disorders of the eye. So again, we're getting into some kind of deep level stuff here, some really sophisticated patient health issues as well, potentially. And then this last area, again, working with the systemic diseases and things that are really affecting a patient's overall well-being. Well, a lot of times optometrists are the first ones to even identify these things. Patients come in asking for glasses or contacts, and they leave with the diagnosis that they have high blood pressure, high cholesterol. We've even had optometrists, not so uncommonly, identify that someone has a brain tumor and needs immediate surgical care, right? So that's pretty amazing for again, a 4-year degree and not a ton of kind of training broadly, but you're really focused in those 4 years, which is kind of fun. So if you want to learn more, there's this great website that covers all the optometry programs, futureidoc.org. So I'm actually going to click through and show you just really quickly what this looks like on the website. So first thing, little plug there, optometry is ranked number 2 as one of the 10 best careers. This is not healthcare careers. This is all careers. So that's pretty cool in and of itself. I didn't make up that stat. Okay, that is there from CNBC. Another thing here, average salary, $168,000, and most optometrists work 30 to 40 hours a week. Okay, so that's pretty amazing that you can be a doctor, have that great work-life balance. These are pretty fun. They're just people's stories. These are optometrists. Obviously, they're young, so they're pretty close to going through school and then graduating the way that you did or will be potentially. And you can hear more about their stories, what they do in their free time, their specialties, all these different areas, right? Talking about that work-life balance, so you can read more there. But one thing I want to point you to as well is compare careers. So I'm not going there for right now, but I think you should go there because it really compares like the average hours, the amount of debt for tuition, the amount of pay and income on the back end. So again, just some really cool things that I think you should spend some more time looking into. But now I'm going to jump over. That was just covering the profession for both of our schools and for all of the schools. But now I'm going to jump into my program specifically. So we are Southern California College of Optometry. We're kind of in your backyard if you're anywhere near Irvine, but we're over by Fullerton, by Cal State Fullerton. So if you want to sign in, I am not spamming you. I do not have time to do that, but I have resources that I will send you after the presentation if you'd like to learn more about optometry. So quick scan on that. I will also drop the link in later. But how we became MBKU. So we actually started out as a Southern California College of Optometry in 1904. Yes, we are almost 120 years old. That is mind-blowing to me. But as everything does, time changes, professions change, and we wanted to change with it, right? We wanted to be on the front end of patient care and not kind of the, well, we've always been around kind of a thing, right? And so we decided, and I won't go into the backstory now, but we needed to add a PA program and a pharmacy program because these are the three frontline healthcare providers that a lot of patients will interact with, right? But little problem there, no PA or PharmD wants to graduate from the Southern California College of Optometry. So we then became Marshall B. Ketchum University, and we have these three specific colleges underneath that banner, and we collaborate really well. So Marshall B. Ketchum actually founded SCCO way back in 1904. So that legacy is built upon him. So our values, I don't have time to go through all of them, but I wanted to put it all up because I think a lot of times we don't know how to choose things for our future because we don't know our own personal values. Therefore, we can't determine if they align with the career path or the program. And so I'm putting these up here for you to kind of see. Now, if you're already applying to our program, a little tip for you, you will have an essay question that says which one of these values aligns with one of yours, and then you tell us why. But I think these are all really, really essential for healthcare workers, right? People who are learning how to be great healthcare providers need all of these characteristics, and this is what we stand for. So how we do that, they're not just buzzwords for us. We have the Center for Interprofessional Studies and then a Center for Inclusion, Diversity, Equity, Accessibility. We call it the IDEA Center. But basically, this is how we kind of have a foundation for everything that we do. We want to make sure you're working and learning in an inclusive environment and not just sitting next to someone in a classroom who's going to go on to a totally different profession. You guys never talk, you never do anything together. You just happen to hear the same lecture at the same time, right? No, our curriculum is completely intertwined for the classes that overlap. You have discussion groups. Yesterday, we had this, we call it Super Sim Day, Super Simulation Day. So our students from all three of the different programs are working together. That little fake mannequin patient there is actually a mannequin that moves. We bring in paid actors. It's super cool. But this is real world application, right? You're also learning about different cultures and how to be sensitive to the needs of the cultures and the people that you're serving within those populations. So that's a really big deal for us, both the interprofessional studies from a curriculum standpoint, and then the diversity, equity, inclusion, and accessibility from the really holistic patient care perspective and for you as a person too. So that was MBKU. Now we're going to narrow focus in just to SCCO. I want to give you a snapshot of what optometry school looks like with us, because I think sometimes you come from undergrad or maybe you're a career changer and you're like, I'm trying to wrap my brain around all of this, right? Well, your first year is only actually 9 months. And essentially you're seeing the little pie chart there, right? So your lecture is a majority of your time, but you do spend a lot of time in lab as well. And just so you know, this pie chart is the curriculum. It's not your free time. We add in free time into this, that lab section opens wide up because you spend a lot of extra time practicing with your classmates, TAs, upperclassmen, faculty members even, and we will get you doing a complete eye exam from start to finish in 9 months. Now, I will say you're not super fast at it, but you can do it. And that's the goal, because we really want to get you kind of acclimated to the nitty gritty of things so that we can build and teach you the more sophisticated aspects of optometry, which I will get into in a second. Your second year is also 9 months. And so again, a lot of lecture, a lot of lab, but you're really starting to get into clinic. So as a first year, you're in clinic, you're seeing some overviews, orientations. Our clinic is gigantic. It's 2 stories. And so it's a little bit of a maze. So you're kind of getting the lay of the land there as well. You get to get your eyes examined, all of that. But second year, you're actually seeing your first patient in clinic, which is super fast and really a blast, right? That's the whole goal. You want to do patient care. So we try to get that in as soon as possible. Lots of school screenings and community service. We have a ton of opportunities there. We really encourage or require students to do that because it helps you, again, hone those skills and develop that heart to serve, which is something our school is definitely known for. You're learning about subspecialties in your second year, but really in your third year is where you get to deep dive into a lot of great things. So we finally passed the halfway mark. A majority of your time is, or over a majority of your time is spent in clinic. And then the lectures are kind of wrapping up just specialties. And I'll talk about specialties in a second. This might be a little over your head at the moment, but we'll get there. And then you're just wrapping up some specialty labs associated with the specialties being like pediatrics or vision therapy, things of those natures. So you're still doing a lot of great community service, maybe some long-term trips as well. And then you're actually choosing your rotations and you're going on, or you're taking part 1 of the 3-part national board exam, which I'll discuss again as well. And then fourth year, you're off on rotation. So you basically are adulting as close as you possibly can. You're doctoring as close as you possibly can without having the official license. But you're basically in full-time patient care at that point, which is super exciting. So if you sign up for the QR card, which again, I'll give you access to that later, I will send you this full breakdown. So you can read through, see a sample, what's day in the life look like for first year, second year, third year, what's the exact curriculum. So I will email that to you after the fact. That's a great thing for you to kind of deep dive into. And then if you have questions, you can ping us and ask us for sure. So Ketchum Health is our main teaching facility. So anytime you saw a clinic on those little pie charts, this is where you're spending that time. And these are the specialties that I was focusing or mentioning before. So again, kind of expanding the way that you can practice and what you might have thought an optometrist does, you can specialize in something without having to go to like 3, 4, 5 extra years of schooling. So you will run through all of these specialty areas in your time at SCCO and the other optometry schools as well. There might be different emphasis or different ways that that's done, but you'll cover all of this in the natural curriculum for optometry. It's not like undergrad where you have to choose a major and then you go, whoop, only doing these classes. You're doing it all. We've got the whole thing planned out for you. If you want to truly specialize in something, you can do an optional additional 5th year, and that's called a residency. So I won't get into that too much today, but really cool niche to be able to maybe see yourself if you're like zoning in on, ooh, sports vision. That's interesting. I didn't know that was a thing. Wait, acquired brain injury? That's where the hospital settings potentially come in, right? So I'll talk more on specialties in a bit here, but that's a picture of our clinic and some of the areas that you'll rotate through. So your 4th year, like I said, you go out on rotation. So you have 4 3-month-long rotations. You get to choose 3 of them out of our network of over 80 sites. And as you can see, the little dots all over the map there, they're all over the place. And then one of them is in the Ketchum Health Network. And so that's your staying local. I'll explain that in a second. But what's really cool about our huge variety of options is you get to choose your own adventure, right? So if you're like, I want to pursue a world of pediatrics, or I want to pursue ocular disease and work with older patients, you can choose your sites completely based on what your future goals are, right? So again, you don't declare a major, but it's a way for you to kind of choose a way to specialize and only work with that patient population base and get really, really good at those interactions. So the Ketchum Health Network. So again, there's 4 rotations. You choose 3 of them completely. 1 rotation, you're required to rotate through our schools clinic. And so that's that top one that in Anaheim where you see the little shield on the map there. That's a snapshot of Southern California. But all those other dots are basically within driving distance. So if you wanted to do Monday, Wednesday, Friday at the main clinic, and then Tuesday, Thursday, you wanted to pop over to the Hurt Family Health Center, which is a low-income facility, and it treats patients who are undocumented, patients from all different walks of life. You might want to pop over to the South Central Community Health Center in Los Angeles, and literally that facility is the coolest public health facility. The optometry services are right across the hallway from psychiatric services, right? So you're seeing a lot of homeless patients. So if you're like, ooh, I have a heart for that, but I don't know if I want to make a career out of it, this is a great way to dabble in it in a little bit, kind of get your feet wet and kind of feel things out for yourself. So a lot of diversity, lots of kind of tailoring that you can do in your 4th year. And if you don't know what you want right now and you're still like, I'm into optometry, but I don't know about the specialties, it's our job to help you figure that out. Okay, so don't worry about it. Don't put too much pressure on yourself. That's part of our natural curriculum. So NBEO stands for National Board of Examination of Optometry. Basically, to qualify and be a doctor of optometry, you need to do 2 things. You have to graduate from an optometry school, which is why we're here telling you about that, right? But 2, you have to pass all 3 parts of the national board. That's a huge deal, right? You can't just skate through optometry school, get straight C's, and then magically pass this really difficult 3-part exam. And so we take it very seriously on how we prepare you for that. I don't have time to go super deep dive into all of these, but basically I want you to see there's a ton of work that we do on the back end. So you could just follow the yellow brick road, right? You just show up to classes, you show up to the trainings, you put in the extra study time when there's groups provided for you. You use the printouts that our academic dean gives you on these are your areas that you're weak, these are your areas that you're strong, according to the last 3 years of data that we've pulled of you, right? So there's a lot that we do to really make sure you're successful. And this for us is a huge deal. And for really all optometry schools, it's a huge deal because if you don't pass the boards, you don't get to practice, even if we graduate you and you get the cap and gown, right? Now, some schools have different ways of doing things. Some schools require you to take a pre-test first. If you don't get a certain percentage on the pre-test, you can't take the national boards until you've graduated, so you don't mess up their stats. We require everyone to take it. That's how confident we are in our curriculum and our preparation for you. We require you to take it before you graduate, okay, all 3 parts. So that's a huge deal. We've got great pass rates because of that. So all of that was academic, but we know you're not just a student, you're a human, right? And there's a lot of complicated things that go into being that, especially when you try to couple it with a 4-year program that's really, really fast paced, right? So we have a ton of support to make sure that you don't just get through optometry school, but you're thriving, you're exploring who you are as a person, you're kind of building upon who you're going to become as a healthcare provider, right? We take that really seriously as well. And so here's just some of the ways that we do that, right? We have peer advisors that are assigned to you and faculty mentors, free tutoring sessions. You never pay for that, whether you want just a little bit of help or a lot of help, it doesn't matter. We have an on-site psychologist that's there in case you hit a rough patch in life or, experience loss or things like that. Stuff happens. It's 4 years, but we're here for it and we're there to get you through. And then things that are next level. Hey, life's going great. You don't have any problems. You just want to elevate. Great. We've got these great professional development series, right? Student wellness activities. We do little walks and yoga and crafting and rock painting with kindness things and just all that fun stuff, right? And so that's a lot of what we do here is those support services. But then there's also other ways that you can get involved in leadership and kind of expand and grow who you are through other avenues. So just diving in here because I don't want to take too much time. Basically, all these areas are areas that you can overlap with students from the other 3 or the other 2 programs as well. So they're co-curricular, they're outside of the curriculum, but they are also interprofessional because you get to work with the students from the other disciplines. And as you can imagine, a PA student who maybe wants to go into open heart surgery as their future career and a pharmacist who really prefers to have one-on-one conversations, but not do anything big or not have to have too much leadership or ownership. They're very different, right? Than you are as an optometrist who's like, yay, come be my best friend for your entire life, right? Totally different, but that's great to learn from those kind of people. And so that's why we want those activities to be not just in the classroom, but outside as well. So last little things here, I'll just put in these academic enhancements that are no additional cost. We have a bunch of electives that you can take. We've got a combined OD-MS program. So if you maybe want to go into teaching or something, you can check out that more on our website. So again, just kind of a quick overview of different things you can help just tailor, make your degree a little bit more, but you don't have to pay any more for it, which is amazing. Okay, next steps in your journey. So you might have caught on to the travel theme here. Now we're journeying on to optometry. If you want to learn more, we have a ton of resources for you. So this does not have to be you going, cool, I found the profession, but now I'm on this like blind, path trying to figure things out for myself. No, we are here for you. I know all the optometry schools are really great and we just have different resources. So if you want to come to upcoming events, if y'all are local, you want to pop on over to the Fullerton area, we've got campus tours and clinic tours going on. We have a lot of virtual presentations going on as well. And if you're getting ready to apply, or you're like, I'm not really sure, come to our workshop. It's in person and virtual. And it's like this is what we look for in competitive applicants. It's really great. I actually had someone say they brought their roommate who was a pre-dentistry student because they're like, hey, they're not that different, right? I could learn about how to be a great candidate no matter where I go. So this might be a great thing for you to just kind of learn about as well. Join us on social media, find us there, right? We're everywhere. We also have a monthly newsletter that's fantastic and gives you like everything you need to know in one email a month. So that's great. Our admissions blog is like the optometry Bible for applying to optometry school. It is written by SCCO, so some of it's specific to our program, but a lot of it's going to just help elevate you for any program that you apply to, right? Studying for the OAT, which is the test you need to take for the schools, that's going to help you for any school you apply to. Learning how to write good personal statements, how to do interviewing skills. So a lot of that is really helpful regardless of where you plan to apply. So definitely check that out as well. So I'm going to kind of wrap us up here. If you want to learn more about the specialties, right? You're thinking, I didn't know that I could go to optometry school and then focus on a population group like kids, right? I want to be a pediatrician, but I don't know if I want to do that much school. And then I'm someone who's serving other people's kids and I can't even see my own because I work too many hours. Well, check out this series. These are all 1-hour series. You can go to the SCCO video page and check them out. We did shadowing behind the scenes in our clinic. The doctors talked about and showed you different technologies that they use. We had patients come and sit for us. And then the faculty did a Q&A and answered anything that the candidates wanted to hear on the call. So these are really awesome. I would highly recommend it's like 6 hours worth of content. Binge watch it in 6 hours or like give yourself a little reward for studying hard and watch, one a day kind of a thing. But that's a really great series for you to just learn more. And then I'll wrap up here. If you have follow-up questions, I am more than happy to answer your questions. Just kick me an email anytime, and all of our admissions officers are there. But if you'd prefer to talk to a student, I get that too. They're amazing. I love talking to them myself, but just go to our website, search for student ambassadors, and that whole group of people will pop up. You can read their bios, you can see where they're from, if they took a gap year, if they went straight through, some of their backgrounds. Hey, I'm a first-gen college student and first-gen grad student, so I had to figure things out on my own. If you want my help, I would love to help you on your path, right? So read that, reach out to them. They're amazing human beings and they would love to help as well. And then again, if you want to sign in and scan, I will send you that document that I shared with you, as well as upcoming events and different things if you want to sign in for those. Okay, so now I am going to pass it off to my awesome colleague here, also in a warm, sunny, beautiful place. Becca, take it away.
Thank you, Erin. All right, everyone. I am Becca. I am from the Arizona College of Optometry. That is part of Midwestern University in Glendale, Arizona. So we actually have 2 locations with Midwestern. So it started in Illinois and then we ended up here in Arizona. So that explains our Midwest name in a non-Midwest state. So the Arizona College of Optometry, we refer to as AZCOPT. We started our first class in 2009. So we actually just had our 10-year anniversary last week on campus. So it was very exciting for that graduating class. And so we'll graduate our 10th class next month. Here. So our class size, we are a little bit smaller than a lot of the schools. We are a class size of 64, but our program, again, is 4 years like most of them, and Erin kind of went over a little bit about that. But our first 2 years are primarily your didactics, so your labs and your lectures, with Midwestern being an integrated healthcare institution. You do take your basic sciences with our dental students. You have about 200 of you in a basic science lecture, and then when it's an optometry specific course, it'll be the 64 of you that moves together at that cohort. Your third year, you'll continue with your labs and lectures, but begin your clinical rotations within the Eye Institute here on campus. And then your fourth year is all clinical rotation. We do also have an interprofessional healthcare course that all of our students take together their first year. So we do have 20 different programs on campus. They're all master's, doctorate level. So as an optometry student, you can be sitting alongside dental, vet med, podiatry, pharmacy, and just getting a greater understanding of the different healthcare professions that are out there, as well as learning how to refer and assist to the different professions. And then we also offer 2 dual degree options, a master's of public health and then a master's of precision medicine alongside that. And then we do have VR Magic. If you haven't had a chance to experience virtual reality within optometry, it is a great tool that just enhances your learning capability. So we do have 12 of these systems on campus. So we have 3 slit lamps, 3 DO, and 6 BIO units. And we'll actually take you on a tour of our lab.
Here in Glendale Hall, the Arizona College of Optometry has a state-of-the-art virtual reality lab for Midwestern's optometry students. The VR Magic Lab has 12 open stations with some of the more difficult medical equipment optometrists handle. AZCOPT students have 24-hour access to get the needed exposure and practice on the equipment in order to become more proficient in these skills. We have VR Magic slit lamps, direct ophthalmoscopes, and binocular indirect ophthalmoscopes. Students are given assignments where they can get first exposure to using the equipment or even get practice examining rarer ocular diseases. As a student at AZCOPT, access to the newest technology and highest quality education will help you become the best OD that you can be. Thank you for coming on this tour of the VR Magic Lab. We hope to see you here soon.
So what's great about the optometry program is we do share all of our resources with all the other programs, the library, your anatomy lab, lecture halls, classrooms, but we have 4 specific labs that are just for optometry. So the VR Magic is one of them. We have a multi-purpose or optic lab, and then our pre-clinic, which is your methods lab. So you spend 3 out of your 4 years in the pre-clinic. You start your very first week of the program learning how to do your basic skills, working all the way up through contact lens. All of our campus is badge access. So as an optometry student, you are the only ones that can get in to our classroom space for optometry specifically. So we'll tour you through our pre-clinic lab.
Welcome to the Arizona College of Optometry's pre-clinic, located here in Glendale Hall. Here is where you will be getting your first hands-on experiences with the things you will learn in your optometry lectures, full of exam lanes, and always open for you to practice. And here, we will have all the resources you need to grow in your skills as an optometrist. There are 30 lanes for you to practice in, each equipped with everything you need to become an eye doctor. Found in the pre-clinic are different types of exam chairs, slit lamps, phoropters, and other equipment for you to be able to practice with and become proficient in, no matter where you will end up working after school. Professors can instruct from this lane in the center. Each station has a display connected to the teaching area where you can watch and learn to apply the different techniques being taught. Here you will spend plenty of time becoming proficient in many skills before you transition to the clinic at the Eye Institute. So we want you to be as confident as you can be. Many slit lamps also have cameras or observation tubes for faculty and TAs to be able to help you refine your skills. The lab also has TAs assigned during class and after hours to help you get as much practice in as you need. The pre-clinic also has 3 special exam rooms, which are exact replicas of the ones in which you will be taking Part 3 of your NVEO board exams. They are fixed with recording devices, which you will be able to use to replay practicing for your boards. Thank you for exploring the pre-clinic with us today. We hope to see you at AZCOPT soon.
So as you progress through after second year, you then move into your clinical rotations. You have 2 half-day clinical rotations within our Eye Institute on campus, and then 4th year is fully rotations. So we do have clinics on campus. They are across the street. So it's about a 6-minute walk between pre-clinic lab that I just showed you and then our clinics on campus. We do have an Eye Institute and then a Therapy Institute. So within the Eye Institute, that is strictly optometry. So it's over 60 exam lanes where you'll do 3rd and part of your 4th year rotations. And we do see every type of specialty within that. And then our Therapy Institute opened just a couple years ago. And that is a true therapeutic center. So it houses our optometry program for vision therapy, sports vision, acquired brain injury, but it also houses physical therapy, occupational therapy, speech language pathology, and clinical psychology. So it's a true therapeutic center for our patients, which is a great aspect that you get to be a part of. And so we'll tour you through our clinic.
Welcome to the Arizona College of Optometry's clinics, located at the Eye Institute and Therapy Institute across the street from campus. Right next to the foyer, you will find our massive optical room. At AZCOPT, students learn all aspects of optometry, including taking care of glasses. Here, you will get plenty of experience walking patients through selecting the perfect frames and lenses to fit their lifestyle, and all the techniques you need for success. With the help of full-time opticians, students become proficient in handling all of the patient's potential needs, including fixing and adjusting frames and lenses. Throughout the building, there are over 30 exam rooms where you will see patients during your 3rd and 4th year. You will apply what you have learned in your 1st and 2nd years here in the Eye Institute. Under the direction of professors who will be your preceptors, students refine their skills and methods of examining each structure of the eye and assessing the overall health of the patient. Also at your disposal is Midwestern's finest technology, including electric phoropters, fundus cameras, OCTs, pentacams, electrodiagnostics, and more. The Eye Institute has expansive rooms for care with contact lenses, and unique to Midwestern is an ocular prosthetics lab where you will be educated on how to craft and provide care to patients who use prosthetic eyes. The EI also has ophthalmologists who practice and do surgical procedures here in-house, so students are exposed to pre- and post-operative care. Professors' offices are also located here in the EI, where you can come seeking help during their office hours. AZCOPT students also get clinical experience at the Therapy Institute, providing care to vision therapy, low vision, and brain injury patients. With adjusted exam lanes to provide special care. There also are different rooms for vision therapy sessions, with enough space for your patient to get meaningful rehabilitation and therapy for their eyes. You will get exceptional vision therapy training as a student here, with access to high-end equipment and facilities. The crown jewel of the Therapy Institute is the Karen system. This computer-assisted rehabilitation environment has state-of-the-art technology and control, all aimed for better care of your patients. The Karen is used with the Therapy Institute's collaborative care model to help patients from all specialties strap into games and environments in whole-body, life-simulated therapy activities. Thank you for touring the clinics with us today. We hope to see you at AZCOPT soon.
So throughout your rotations during your 4th year, you will be in the Eye Institute and the Therapy Institute for one of them. And then the other 3 are throughout the United States. So the kind of map just kind of gives you a glimpse as to where we're at within about the 30 different states right now. Your rotations are again based on your preference and not on your GPA or class rank. So you can kind of pick and decide what areas you're looking to go into as you explore those. Here we go. Just to give you a little overview of tuition, because everybody loves to talk money. We are a private institution, so we don't have an in-state or out-of-state quota requirement. So tuition with that. So that will stay the same either way. So you're not trying to establish residency when you move here. But within our tuition, we do include parking, our gym, the lockers you might have seen in one of the videos, and then counseling services. And then there are also on-campus apartments that you can apply to live in that gives you a little more convenience of living on campus. And then this is a glimpse of our 1st year class that's actually getting ready to finish in the next couple of weeks. But these are our stats and the averages of the class that's at this past year. You do get your white coat fall quarter of your 1st year. We want to make sure that you have that every time you go out into the community. You'll wear it when you're doing your practicals in the methods lab, and then obviously you'll wear it every day when you get into clinic. And then we'll take you on a little bit more of a tour of campus that just shows you a little bit more outside of the building.
Welcome to the Arizona College of Optometry's beautiful campus here at Midwestern University in Glendale, Arizona. Midwestern University is known as one of the most naturally beautiful campuses in the West and holds a reputation for having a wonderful student experience for learning and becoming an esteemed medical professional. We start at Saguaro Hall. Saguaro Hall is home to the library, full of study space, computer access, and medical resources. Saguaro Hall also has lecture halls and anatomy labs for in-depth education. Next is Glendale Hall. Not only does Glendale Hall house the campus testing center for most of the students' exams, but smaller classrooms and offices for the College of Optometry. The Auditorium Hall is one of the most unique buildings on campus, having one giant auditorium that can house graduations and white coat ceremonies, but can then be divided down into individual lecture halls for your daily classes. Ocotillo, Cholla, and Agave Hall each have lecture halls and classrooms that you will occasionally have for classes and club events. Auxiliary buildings, Barrel 1, 2, 3, and 4, each house important services to take advantage of. Cactus Wren and the Science Hall are some of the newer additions to campus. Here you will find classrooms, as well as some office hours for your science professors. But what fun can you have on campus? We find in the Wellness Hall a full-size gym, exercise rooms with bikes and equipment, a racquetball court, and more. There is also a campus clubhouse with a pool table, ping pong table, theater-style TV setup, as well as more space for eating, studying, and exercising. Thank you for exploring the MWU campus with us today. We hope to see you at AZCOPT soon.
So for those who are not familiar with Glendale, Arizona, we are a suburb of Phoenix. We're about 30 minutes northwest of downtown. So we're in a very residential area, and I honestly forget we live in a big city, and we are growing. We're like the 5th largest city in the US now, so we continue to grow. We do have every major sports team. If you're interested, if you like sports, we have those, especially baseball and spring training every March. You do get to participate with division screenings for the AAA and the single and AA teams when they're out here during the month of March for that. And it's a quick 5.5, 6 hour drive back to California, so you can go back for the weekend. And then if you want to experience a little bit more of weather, you just go 2 hours north and you can get some snow during the winter and then come back down. And then we also have a summer program every year. It's a 3-day immersion program. Oh, sorry, I'm talking about a different slide, but I'm showing you a different one. So student life on campus. So there's just a couple glimpses of our students and some of our faculty with them. We do regular hikes when the weather is nice, which is right about now, with our faculty and significant others, and everybody brings their dogs. It's a lot of fun. We also do research day, and we just had the eyeball, which is our annual prom, and then every fall now we have what we call our AZCOPT back to school bash. So they cancel classes and clinic for a Friday afternoon. All of our faculty in all 4 years and the staff come out and play and just yard games. So water balloon toss, 3-legged race, pie eating contest. Just have a good time getting to know the new class that just came in and reconnecting with everybody else. So great interaction with our student body. And then this is our immersion program. So we call it AZCOPT. It happens every June. It's just a great 3-day experience to get a glimpse into what it would be like to be in optometry school, what an optometrist would be. You get to know future classmates, future colleagues. It's a free program to attend. It just costs your travel requirements for that. So that has a little bit of that for you. And we are on social media as well, Facebook and Instagram. So feel free to check us out and follow us. Student life, definitely that's going on there. We had a walk on campus yesterday, so I had a little bit sharing about that. They do trivia Thursdays, so feel free to get to know a little bit more before you jump into school. So, and we're good to go. Are we moving into questions at this point?
Yes, we do have 10 minutes for a Q&A. So for participants, if you have any questions, feel free to either unmute yourself and ask questions of our 2 representatives, or please put your question into the chat.
I did see one while Becca was chatting about being able to take tests other than the OAT. So in order to apply for the program, there's kind of standards that every school has, and there are some nuances. Every school accepts the OAT. Some schools like Midwestern and SCCO accept alternate test scores, MCAT, DAT, things like that. So definitely look into the programs that you're looking at. If you are like, I'm not really sure which school I want to apply to, but I need to take the OAT at this time or the standard test at this time, I would say take the OAT. That way you're not stuck in a place where you took maybe the MCAT and then you decide 3 months later you want to apply to this school that doesn't allow the MCAT, and now you've got to take a second test. So there's no preferential treatment if you don't take the OAT or anything, but it's just kind of one-stop shopping, and then you're just spending your money, your time, and your energy on one test that's going to catch them all. Saw a hand raised. Do you have a question?
Yes, I do. So I am actually a liberal arts major, and recently I've just been very interested in optometry. And I was actually fortunate enough to shadow an optometrist recently, and it was a really great experience. But I was wondering, do I have to be a specific major in order to apply into optometry school? Like, what would you recommend that I possibly do so I can better prepare?
Becca, you want to take that one?
Yeah, sure. Yeah, we don't require a specific degree requirement. We have students who come in with psychology, music, business majors. Obviously, if you're in a science base, it's going to help you complete all the prerequisites. But we want you to be successful in whatever degree you're obtaining. So as long as you're successful in the science classes, that are the prerequisites, because you are going to be heavily science-based when you're here. So we want to make sure you're setting yourself up for success there, but you don't have to have a specific degree in order, as long as you have your degree, you don't have to have a specific degree area in order to apply.
Yes,
Thank
and
you
I'll
so
just add on something kind of a separate topic, but sort of related. Sometimes students think, oh, I wasn't a science major, or I didn't work at an optometry practice, or I'm a career changer, I took a gap year. Those kind of things make me less competitive as an applicant. They really don't. They can actually make you stand out. You have a different perspective coming in than a lot of the people do. So share that. How has that uniqueness made you a great candidate for the discussion groups that we're having? How would that make you a more empathetic, healthcare provider or classmate, maybe a better leader, right? So don't ever see your past as like, oh, something I've got to overcome this obstacle. It really could be a strength. That's all in just how you look at it. I saw a question about where the ADA or OAT being administered by the ADA. Yes, so the ADA is American Dental Association. Totally confusing. Basically just because that's the governing body that oversees the testing, but has nothing to do with dentistry. So doesn't matter. OAT administered by ADA is the correct test that you're looking for. Good question. Anybody else have questions? Oh, you're welcome. You're welcome. Becca, okay, we got a few minutes, so I'm going to ask you a question. Ready?
All right.
What is something that you wish every applicant would know coming into the application process?
Oh, only one thing?
1 to 5, 1 to 5, no.
So the biggest one I would say, apply early. Everybody kind of runs on a rolling admission, and we interview and accept as we go. And even though we have deadlines, don't wait till the end, because seats could be full and you could be an incredible applicant and we can't offer you a slot. So apply earlier in the cycle, within the first 3 to 4 months. Is what I would encourage you to do. My other thing that I would say is, if you are offered an interview and you are signed up and scheduled for one and you decide you're not going to attend, please let us know ahead of time. That's the courtesy that we ask, but it shows your professionalism that we're moving into. So those would be the 2 things I would say. Apply early, and please be professional throughout the process.
Yes, I agree. I agree. So I piggyback on the first one 100%. Unfortunately, we're at a time in our season where we have these phenomenal applicants. And I'm like, if you had applied 3 months ago, you'd be in, and you might even have a scholarship. Right now, you're going to have to go on an alternate list and just wait it out and see. Right. And that's simply, and we know life gets in the way. You'd plan to apply earlier and different things, but if you're not sure and you're getting towards the end of the cycle, you had good intentions and it's just later because stuff happened, I would say reach out to the admissions offices and just go, hey, here's what my stats are. Do you think it's worth me applying now, or should I strengthen, regroup, and then apply early in the next cycle? We don't want you to waste your money or your time, right? We'll let you know, we'll be honest, but we can only communicate when you communicate first and ask. But we're happy to. We know all of our colleagues in optometry. It's a small little world. There's only 24 schools, and I know everyone's super great. So even if you're not applying to either one of our schools, reach out to the admissions offices, and they're really happy to help you.
I actually have a question for both of you, and I think you may have mentioned it briefly here or there within your presentations, but as students are kind of deciding different options, okay, optometry, pharmacy, dental, and so forth, especially the ones who are just kind of starting out, why optometry over maybe some of the other professions?
Did you say what?
Take it away.
Yeah, why optometry? And I know the answer to that because I'll be honest with you, if I knew what I know now, both basically the pay and the lifestyle and so forth. But if you could both speak a little bit more to that, why is it such a rewarding field and also a great field to be in? And not to say that any of the other fields are bad, okay, but I know that there are definitely distinct advantages within becoming an optometrist.
Absolutely. So I think, the great work-life balance with that. So you're not, most of the time, you're not on call. Depends on where you're working, depends on where you choose. But you can balance your life. You're not taking it home at the end of the night. It's not a 12 to 14-hour shift, 8 to 9 hours, and you get to know your patient. We go back every year, or we're supposed to. But then we get to know, so you get to know your patient base. Your optometrist knows who you are. You know who your patients are. You get to see them and you see their life grow and family. So you get to have that connection other than just meeting somebody once and having them go on. And it's an ever-evolving profession right now. It is continuing to grow. The scope of practice is changing. What optometrists can do versus what they couldn't do previously is progressing. And so it's a great profession to be a part of at this point in time. And it's continuing to become, as Aaron mentions, the number 2 right now in careers. So people are figuring it out and deciding that, oh, this is really worth it. And I know it sounds silly, but for most of the part, there's no blood. And I know that one of our faculty is like, I wanted to be in the healthcare profession, but I don't like blood. So I went to be an optometrist because you don't have to deal with that. So there's different aspects of what you can be a part of and what you don't have to, and how deep you want to dive into it. And so it has those perks to it.
Yeah. Now, I'll add in one thing too. I remember when I was 18, 19, 20 years old going, what am I going to do with the rest of my life? The pressure to pick one thing that you're going to be interested in and passionate about for 50 years worth of a career, and just going, I don't even know what major I want to pick, or where I want to go to dinner, or where I want to move, right? Let alone something I'm going to do for 50 years. Well, the awesome thing about optometry is that variety of being able to say, you know what, I loved working with kids and that was great, but I think I want to own my own practice now. You don't have to go to school for that. You don't have to get an MBA for that, right? You've got 80% of the skill sets. Then you just plug into mentorship and people who can help you figure out the business side, which there's tons of great organizations that do that. You can totally reinvent yourself. Or maybe you go into it thinking, man, I love working with geriatric patients. But then it gets, to a point in your life where you're like, I love working with them and I still want to, but now I'm a mom and I've got 3 kids and I want to be able to coach their softball team and I want to be able to have some work-life balance. You can just cut back on your hours and still do the exact same thing you're doing without having to completely let go of your career and drop all of your hard work and still have kind of one foot in, but that work-life balance, right? That's not something that's true of a lot of careers. A lot of careers, you take a step back to be a mom or to deal with a health challenge or something, your resume has a gap in it, you're kind of out. Right? People surpass you. You're not taken seriously. This profession is known for people kind of adjusting to accommodate their life circumstances, or even just taking off from like 12 to 3 so that you can pick up your kids after school and get them off to softball practice or whatever. And then you can tell what world I'm in right now. Right. But that's a really important thing because you don't know where your life's going to be 20 years from now, 30 years from now. You don't want to go, oh my gosh, I worked this hard, spent all this money, finally paid off my student loans, and now I want to go part-time to be able to enjoy part of my life in this way, right? Optometry is super flexible and really rewarding too, because you don't have to lower your standards of what you can do. You can just adjust the time in which you do it.
Looks like there's one kind of half question comment on there. Difference between ophthalmologist versus optometrist. Yeah, go ahead, Becca.
I can grab it. Yeah, really good question. So it's not a situation where you become an optometrist and then decide, ooh, I'm done doing the great things I can do in optometry. I want to do surgery. So now I'll do additional school. It's two separate career paths. So optometry is a 4-year degree. That's what we've been talking about here on this call. Ophthalmology is the in-depth surgical procedures. Okay, so you're going to medical school for about 4 years, then you're doing fellowships and residencies and different things to be able to do those procedures. One quick thing that I will say actually is a lot of students go into med school not realizing that if you want to be an ophthalmologist, let's just say, you don't just get to choose it like you choose a major in undergrad. You actually have to qualify and be accepted into additional residency and fellowship programs. A lot of that is based on your test scores that you take after the 4 years of school. We actually have a student who graduated from a program a year ago who went through all 4 years of medical school, did great with his GPA, but his final test score wasn't strong enough. And they said, oh yeah, you can choose from all of these careers, but you'll never get into ophthalmology. It's too competitive. There's too few spots. So choose one of those instead. He was like, no, I love vision care. I love the holistic nature of it. I want to go into that. And they said, well, sorry, end of the road here for med school. So he came over to us and started all over again and did optometry. So again, a lot of people don't understand it's this long career path just to focus on surgical procedures. But what's super cool, and Becca touched on this, is scope of practice expansion optometry. We actually, as optometrists, can use lasers and minor surgical procedures. Optometrists are doing injections now. I mean, there's a lot that optometrists are carving into that is overlapping, or even just taking some things off of ophthalmology's plate, or we can do it as well. And so, you know, you're looking at a 30, 40, 50-year career, you're going to be able to do surgeries either now, if you want to move to certain states that already have that scope of practice available, or likely somewhere within your career. State of California was super close to being able to have lasers as part of our scope of practice, super close, which is amazing because I was told, hey, if you work at SCCO for 40 years, well, and I've been here for 11 now, they're like, maybe you'll see it towards the end of your career. Well, we're this close and I'm a decade in, so we're going to get there, right? And Becca, Arizona is right there too. We're all fighting for it. So there's definitely differences, but I would say the massive difference is the work-life balance and the path to becoming both of those. 4 years in optometry, 7, 8, 9, 10 to ophthalmology, depending on how far you take it.
Looks like we're pretty much out of time, but I'm going to actually squeeze in one final question. And actually, this one is for everyone, but also for my own knowledge and understanding as I improve my information to be a better health professions counselor. Okay. In your evaluation of students, you probably see, a number of students who may apply who may have that GPA that isn't there yet for optometry, as well as other health professions. Let's just say that they were at the community college and they had around a 2.7-ish, and then they transferred to the university, initially intending to be, to go in one of the health professions field, and they're also a 2.7 GPA. Now they're here at the community college, maybe wanting to take additional courses. What can students in those scenarios do in order to be more competitive to potentially get in? Do you have a minimum GPA? And also, what can students do to improve their chances of getting in to your various schools? Let's start, Becca.
Yeah, I was like, I'll give Erin a second to break. So it's a couple folds. So if you're gonna move to the community college and take some courses, we want to make sure they're getting solid coursework. So they're taking several units to show that they can do a full load and getting A's and B's and all of that. And then the other thing so absolutely it happens, and we understand it's a lot cheaper too. So we do accept that. And then one of the things to keep in mind too when advising students about retaking courses or adding additional courses on is OptumCast, the application service for optometry, doesn't honor grade replacement. So I know some schools will go back and do that. We are not one of those. So keeping in mind, they think if they got the C, use the I, and then they go back and take it at the community college and they got the A, that the A is the one that's going to count. But they actually both go into the GPA. So that's something to keep in mind when advising for that they're both going to get factored in. But obviously retaking and the improvement, we do look at academic trends, we look at the amount of the course load and want to make sure that everything's just an improvement moving upward. So it's okay if it's the community college versus the university level. The other one that also comes up is online coursework a lot these days, and we will accept them, but we do encourage the students to take those in person just because our program's in person, and so we want to make sure that they're comfortable and capable to be in that in-person environment as well.
Okay, Erin, anything else to add?
100%. Same exact answer for what Becca just covered for our program as well. The only other piece that I will add is when we're looking through your transcripts, like Becca said, we're looking for apples to apples. Did you do full course loads there? Great, because you're going to have to do full course loads here, right? Did you do in-person there? Great, you're going to have to do in-person here. And again, there's nuances, it doesn't have to be all perfect. But the other thing is we're trying to build a case for you of like, okay, why is this person, getting straight C's and all of a sudden they got all these A's and B's? Like, what was going on with the C's? We're going to look to your experiences section. We're going to look to where your time went outside of the classroom. I've got a student who is about to finish his first year here. He is a 2.6 overall GPA, my friends, but he scored in the top 3% in the nation on the OAT. And I had a conversation with him. That was his second attempt at the OAT. I had a conversation with him when we hit deny on his application, and I shot him an email. Hey, we see some potential. Call me if you want to have a conversation. And he did, right? So we had that conversation. I said, what's going on? How do you get fairly decent OAT scores, but not that great with this GPA? And he goes, well, ma'am, I was working 40 to 60 hours a week all throughout undergrad. I was like, there it is. That was not on his application. How are we supposed to build a case for your grit, your determination, your multitasking, your focus, your ability to contribute in different areas, right? And so he then reapplied, and I told him, you really need to show us that you can study and concentrate. You don't need to go back to school and spend all that money and do a full course load, but OAT, right? Focus your energy there. Let's see what you can do when you're not working 60 hours a week and doing school and OAT too, right? And he's doing great in our program now. So give yourself enough information on the application to let us have some grace with where you're coming from, right? We want to admit you. We want to help you reach your dreams, but we will not admit you. And I know Becca's school is the same way. We won't admit you and go, hopefully they make it through. No, we're only admitting people we're confident we can help get through in hopefully 4 years, 5 if absolutely necessary. But these are your hopes and goals and dreams and finances on the line. We're not just going to roll the dice and cross our fingers, right? We're going to commit and get you through, but you have to give us enough to give us confidence to admit you in the first place.